Good morning. Today I'm going to take you along in a day of the life, pregnant and getting cancer treatment. It is currently 7:40 in the morning. I'm a little phlegmy still. We're getting ready to go to the hospital. I'm making 2 soft-boiled eggs that I'm going to eat now. This has been such a game changer, just soft-boiled eggs. They have to be soft, and it just goes down very nicely. I'm gonna also take along some Greek yogurt with some blueberries that I'm gonna put some protein powder in. I have some decaf green tea. Green tea is really good. I'm gonna put some manuka honey in it. The backpack that you see here, you can see I'm attached to a little cable. This goes right into my port. Yeah. This is my extra nutrition. It's gonna be run through, like it runs for 14 hours and I'll let it go overnight. It's not quite through. It's gonna be done by the time we arrive at the hospital. Today is chemo number 2. Let's do it. Okay, I'm here now and they're putting in, this is the port, and let's see. That's my medication, or part of it. And then I think part of it I'm gonna take home with me. So I'm just lying here, I'm chilling. I just ate an apricot. I wanted to eat my yogurt, but I think the spoon might be in the car. So I'm just chilling a little bit. I am done. We are on the way home. I have my little, you can see it here. I have a little package. This is where the pump is, and then I got my little hose here. When I get home, I'll put it underneath my dress. 2:30. I haven't had lunch yet. Which, thank you everyone for your tips in the comments. I appreciate it. At the same time, I do want to explain again, because I've had a lot of new subscribers. So everyone who's following my journey, what I'm hoping to do here is just to document for myself and for my family, and give everyone hope that this journey, it's something that I'm just on, and if I can do it, you can, if someone were in this situation, you can do it too. The problem that I have had with eating is just that my stomach revolts. It's, basically there's a tumor in there, inflammation, it's destroyed, and I can tell I've had that really horrible stomach pain. It's extremely sensitive. So things such as meat, yesterday I experimented and I had some pasta for the first time for weeks and weeks with some bolognese sauce, which contains beef. In the moment it was good, and then unfortunately later that night I had a vomit, and only, sorry TMI, but it was only the meat, because everything else was digested, because it digests quickly. My body just cannot handle meat yet. So yes, I do have chicken soup, and we do make bone broth, but even water, even a sip of water, anything that reaches the stomach causes pain. So I just want you to understand that. So anything like high caloric drinks, I've tried it. Broccoli, I have to live in the moment and in the day and feel whatever I feel I can handle is usually what I can handle, and it changes every day. So if I'm feeling broccoli is a good idea, and I know what things are good and what things are not good, but I have to also at the same time play it by ear. Sweet potato has been good, but very soft puree. I eat fish, soups, anything that isn't too hard. I chew for a long time. So it's not easy, like say, well, eat this because it's good for my body tells me. So with that, I'm gonna pause the extra nutrition for 2 days now because I'm on the chemo. I'm back. It's a couple days after the last bit of this video, and I just wanted to show you the reality of this. Yeah, I look tired because I've been lying around. This is the reality of, chemo. I wanted to show you this. This is where the chemo medication is in. And you can see it looks like a tube now. This tube was actually like a balloon a couple days ago. It's almost done. And what it does, it's a really cool device because it releases the medication over the course of 48 hours without electronic stuff. It's just the balloon basically has like a pressure, and that's what releases the medication. So this is almost done. Yeah, it's been about, I think, another hour, and then it's officially 48 hours. Because I have not had my extra nutrition bags for a couple days now, I can really tell the difference. And of course, the side effects.
Mama, ich habe noch.
Oh, danke, Schatzi. And the side effects, I can tell.
Mike hat einen Würfel.
More nausea. It was so much better before.
Mike hat einen ganz
More
großen.
nausea.
Da ist
Super,
was drin.
Ja, mach's rein.
Und hier ist noch
Emil
klein.
is just showing me something. And so I've been lying around basically for the past couple days because I'm tired. I feel nauseous. Baby is kicking up a storm. There was a comment below one of my videos. You cannot do chemo when you're pregnant. Yes, you can. You can't do every kind of medication. But as a matter of fact, I am in a Facebook group. There is a Facebook group actually, Pregnant with Cancer. And a lot of women there talk about, their stories. And a lot of them, most of them actually had chemo while pregnant and had healthy babies, which is very encouraging. Of course, you can't do all medications. You're limited to what experience says is not harmful to the baby. I'm gonna stop talking now because it's a lot. So I'll be back, reporting back, hopefully when I feel a little bit better. It's a few days later. I think 3 days after, or a couple days after the last bit. And the side effects of the chemo are slowly subsiding. What are some of the side effects? Actually, after chemo number 1, I had quite a few times of nose bleeding, pretty bad. I didn't have that at all this time. You can see my tongue has this white stuff on it, and that was last time too. It was kind of a green-white stuff. I am always rinsing with a mouthwash, a natural mouthwash, because what you can get is like an inflamed mucus layer, membranes. So trying to take good care of my oral hygiene these days. Another thing is extremely dry skin, and I'll show you my belly. As of tomorrow, I'll be exactly 25 weeks, so I'm 24 weeks, 6 days today, which is a big win. What I also wanted to show you is my extra nutrition. So this is the backpack where I carry it around. It's quite big, and it's just, but I'll show you what's in here. So this is kind of like the little line. This is where it runs through, and it's kind of like a telephone cable, which is kind of nice. I think it's through. I leave it on overnight. It runs for 14 hours, and then there's a pump that takes care of. It's trying to repeat what I'm saying. Okay, here we go. Oh, it's not actually all the way through yet. This is the pump, and the pump is attached to the bag, and I'll show you the bag should be almost empty by now. Pretty much. Oh, there's still a little bit in here. So this is the bag. So it's yellow, but there's it's a white solution. It looks kind of like milk. I always joke around and said it's mommy. I say it's mommy's milk. This is where it goes into. Yeah, it's pretty much run through. And Amy, yeah, you can still see the scar here from where they put the port in. They put this translucent Band-Aid on top, so it allows me to take a shower. You can still see my skin is very, my skin looks so like I'm 90 years old right now because the fat is just, there's no fat under it anymore. Also attached are two flushing syringes. There's a lot of cables right now here. I'm trying to take this out. So when this is run through, as a matter of fact, I'm actually going to go ahead and stop it now because this is, how much is it? It's, I think it's 1,200 milliliters, which is 1 liter and 200 milliliters. Yeah, 1,200 milliliters. And it's got 1,480 calories, which is awesome. Makes such a big difference in how I feel. When I did the chemo, I had to pause for a couple days, and I could definitely tell the difference. So I'm gonna stop the pump now. And this thing costs, I'll take this out here, and then I'll charge it again for the next round. And this thing costs, I think I mentioned it before, 4,500 euros. I mean, so I'm borrowing it basically from the service. Now what I'm doing, there are the flushing syringes.
Flushing.
Yeah, flushing. And I'm gonna go ahead and use those and flush my port. Because right now, there's this nutrition solution in here. We have to clear it out so there's nothing stuck in it. We need to always make sure it's clean. So I always flush with 2 syringes. And before I put the nutrition on, I flush with 1 syringe. So what I need to do now is, it's open already. So there's a little clamp here. It's open. So I'm going to use the first one. I'm gonna do stop and go, stop and go, stop and go. And because this is so tiny, it's kind of, I have to apply a lot of pressure. But I can already see it's moving through. So 1, see, it's clear now in this little piece here. No more milky solution, but I'll do the second one to make sure it's all clear. And now I'm gonna detach this one right here. I'm gonna screw this off. And now this is a cap right here, and it's there's some disinfectant solution on here. See, it's almost like a little sponge in there. And then I will screw this on. Yep, ooh, smells very much like disinfectant. And that's it. I have a little, there's a Velcro here, so I can close this up and it'll stay kind of put. And then I can put my shirt on and go about my day until I put it on again. And the nice thing about the port is that they don't have to poke me. They do have to poke me once a week because we have to change out the port needle once every week. So, you know, checking and making sure it's clean and that there's no infection going on. So just wanted to show you that. And I'm going to show you my belly. For those of you who are a little sensitive, there are still some bruises and some spots on my belly that don't look so appetizing because of the laparoscopy that I had. It's been 4 weeks, but it's just crazy. You know, these were holes in my belly basically, but I'll show you my baby belly. Okay, so here's the belly, and it's very dry skin. I mean, I have been putting lotion on, but I need to do it multiple times a day, like on the side here, because there's also a lot of stretching going on. It's just so dry. So this was hole number 1 from the laparoscopy. Let's see, where was the second one? Here. there's still kind of a bump. You can see how there's a bump. And this was the third one. This one healed nicely. But this is just the bruising around this whole area. Baby is kicking up a storm. Like I said, tomorrow I'll be exactly 25 weeks. And yes, it's hard. The hardest thing right now is like there's a lot of going on in my abdomen, inside of my belly. There's a baby growing, which that by itself is a lot of work for my body. And, you know, around 25 weeks, that's when it really starts, you know, entering third trimester, I think, pretty soon here. Yeah, that's a lot. So it's starting to get heavy, and at night I have to put my body pillow, you know, under my belly. But then also my stomach is getting pushed, which there's already so much, you know, it's very, pressure on my stomach is just so hard right now. It's been painful for months now, and now there's extra pressure on my stomach. A lot going on. And then on top of that, another side effect from the chemo this time around, my digestion has been not so good. It's like, it's a mix of constipation and diarrhea. I don't know what it is. It's really weird. I've had one night where I could hardly sleep because I was cramping so bad. Oh, on top of that, I'm starting to have Braxton Hicks sometimes, mildly. So now it's really like a lot going on. You know, there's you know, my uterus gets kind of tense because of the Braxton Hicks. The baby sometimes moves like crazy, and then my stomach hurts and cramps sometimes. It's a lot. However, I'm staying positive. There are so many new subscribers. I never thought like this would be a topic that is so interesting, but it seems to be very interesting to a lot of you. The main reason why I want to document is just number one, for myself and my family, and number two, for anyone who is in this situation, pregnant and dealing with cancer. You can get treatment. There were some comments that you cannot do chemo if you're pregnant. Yes, you can. You can't do all medications, but there are some that you can do, because doing absolutely nothing is not an option. And some shape or form of chemo, yes, I'm aware of all the other alternatives. I'm totally aware. You can do a lot still. And I'm gonna wrap up this video for now. And I'll try to give you an update when there's something to talk about. Thanks to everyone who is following me. I appreciate all the encouraging comments. There have been a few comments that weren't so kind. You know, like, oh, I hate when people talk to me in third person. It's like, talk to me personally. It's like, oh, can she be pregnant? She looks like she's 60 years old. Maybe I don't look my best right now. I don't care what anybody thinks. It's like, I'm going through a lot of stuff right now. But I believe it'll be okay. Thank you, and I'll see you next time.